All right, welcome to The Explainer. Today, we're diving into a really important topic, one that's often shrouded in mystery: psychiatric emergencies. We're going to break down what exactly happens when a mental health struggle escalates into a full-blown crisis, and then look at the professional, structured response that's designed to bring someone back to a place of safety. It's a heavy question, isn't it? What happens when thoughts or moods become an emergency? When does a personal internal struggle cross that invisible line and become a crisis? That's the boundary we're going to explore today. So, to really get a handle on this, we've got to start with the language. Understanding the key terms, the difference between the crisis itself and the response to it, that's really the first step in demystifying this whole thing. Okay, this slide really lays it out for us. You have two sides to the same coin. On one hand, you have the psychiatric emergency. That's the event, the acute disturbance. On the other, you have the crisis intervention. That's the professional response. You can think of it like a storm and a lighthouse. One is the danger, and the other is the guide to get through it safely. Let's zero in on the emergency part for a second. The two most important words here are acute and immediate threat. We're not talking about a chronic, long-term struggle here. We're talking about a very specific, sudden moment where safety, either for the person themselves or for others around them, has become the absolute top priority. And the response to that emergency? That's crisis intervention. It's got two main goals. First, provide immediate care to de-escalate the situation and make sure everyone is safe. And second, help the person regain their balance. Find their equilibrium again and hopefully prevent any long-term harm. So we have the definitions down. But what does a psychiatric emergency actually look like? How does it show up in the real world? Well, the signs can be incredibly varied. A psychiatric emergency isn't just one thing. It's a whole spectrum of different crises. It can involve the risk of self-harm or violence, sure, but it can also be a profound internal crisis, like an acute psychotic episode. It even covers severe physical states that are tied to mental health, like catatonia or delirium from alcohol withdrawal. The big takeaway here is just how broad this category really is. This right here, this is what makes these events emergencies. They don't just slowly build, they erupt. It's that sudden beginning and the speed at which things can get worse that means you simply can't afford to wait and see. That's why a fast professional response is so crucial. So let's put it all together. The picture of an emergency becomes pretty clear. You have a sudden event, there's a real risk of harm involved, it completely disrupts a person's ability to function normally, and because of all that, it demands immediate help. All those pieces have to be in place. Okay, so once an emergency is recognized, what happens then? What's the first move? The response always begins with a single, non-negotiable priority: safety. This quote really says it all. The number one rule, the guiding principle, is that before anything else can happen, you have to make sure the environment is safe. Safe for the patient, safe for the staff, safe for everyone. Everything else has to wait. So how do you achieve that safety? Well, professionals have a clear playbook. It always starts with the least invasive options: a calm voice, a supportive attitude, and verbal de-escalation techniques. Only if that's not working are things like medication considered. And all the while, they're keeping a close eye on vital signs, making sure the person is physically okay before they're referred for more help. And that brings us to the intervention itself. Now, this isn't just an improvised, frantic reaction. It's a methodical process. It's a structured path that's designed to carefully guide a person from that state of chaos back towards stability. This 6-step framework really shows you the journey. It starts with building rapport and ensuring safety, because without trust, nothing else works. From there, it moves into assessment. What's really going on? Then, together, they explore solutions and put a plan into action. And what's so important is that it doesn't just end there. The final step is follow-up, making sure that person has the support they need to stay well. So what's the whole point of this process? What's the end game? It's about so much more than just putting out the fire of the immediate crisis. It's about restoring balance, easing that intense anxiety, and, this is the big one, building up that person's coping skills and plugging them into a support system for the long haul. It's about building a bridge to a more stable future. Of course, none of this happens in a vacuum. A person in the middle of a crisis is surrounded by a system of dedicated professionals, and, just as importantly, legal protections. Let's take a look at these guardians of care. The mental health nurse is often the quarterback of this whole situation. Their role is just huge. They're the ones doing the initial assessment, carrying out the intervention, but they're also advocating for the patient's rights, educating the family, and coordinating with the entire medical team. They're the hub that connects all the moving parts. And holding this entire process together are these strict legal and ethical guardrails. These rules are there for a very important reason: to protect the rights of a person when they are at their absolute most vulnerable. This means following the law on admissions, making sure consent is handled properly, protecting confidentiality, and documenting every single step to ensure accountability. And these aren't just abstract ideas. In India, for example, the Mental Health Care Act of 2017 created a very specific legal framework just for these situations. It sets the rules for everything from emergency admissions to treatment, making sure that all actions are lawful and put the patient's rights and well-being first. So what we've seen is that what can look like pure chaos from the outside is actually met with a very structured, professional, and compassionate process. Just knowing that the system exists is pretty powerful. Which leads us to our final question, for all of us, really. How can knowing this, getting this peek behind the curtain, how can it change the way we all talk about mental health and maybe help us replace a little bit of fear with a lot more understanding? Thanks for joining this explainer.